This educational video has been developed by Shannon Henderson, Nicole Jetta, Tracy Kearns and Kerry McKenzie. And we will explore mood disorders, what effects various mood disorders can have on you in your daily living, medications available that may assist you in managing your symptoms and to aid in preventing a relapse. We will also cover the signs and symptoms to look out for that your medication may not be working as it was intended to do so, and we will discuss side effects and how the medication actually works in your body. Mood disorders can generally consist of 4 different types of emotional states, such as your normal mood, depression, mania, and hypomania. For example, if someone is having a manic episode, then they will have an elevated mood where they can feel on top of the world with grand ideas and gestures. The other state is known as a depressed state, where you may feel so down, tired all the time, have difficulty sleeping, or you may find it hard to just leave the house. Hypomania is similar to having a manic episode, but its symptoms are less severe than that of mania. Some people may also find themselves in a mixed episode, where they experience symptoms of both the manic and depressed state for more than 1 week. When people experience a manic state, they can have poor judgment and can forego their usual responsibilities in life, such as caring for a child or attending to important commitments like work. During this time, they may do things that are out of character for them, such as uncontrollable spending, where they may waste hundreds of dollars on clothes shopping, for example, whereas if that person was in a normal state, they probably wouldn't normally do that. Or the person may do other risky activities that are out of character for them, such as skydiving or driving a car unsafely. One example of a mood disorder is bipolar disorder. A person with bipolar disorder will generally experience moods that are elevated and low in nature, which can be categorized as cycling between the 2 moods. Bipolar disorder is a leading cause of disability amongst young people and can severely affect their lives with an increased mortality rate from suicide, functional and cognitive impairment, and cardiovascular disease. This is where medication suitable for mood disorders can assist a person to lead a normal, functional life.
Mood stabilisers are a group of medications used to typically treat those diagnosed with a mood disorder. However, they may also assist people with other disorders such as epilepsy. Generally, for a drug to be classified as a mood stabiliser, it should effectively treat and prevent episodes of depression and mania. Mood stabilisers assist in the treatment of mood disorders by altering the way neurons interact in our central nervous system. Neurons are cells in our body that process information, for example, sending signals to our brain from another area of the body to perform a particular action. This is where the limbic system in our body comes into play, as it is the part of our brain that controls our emotional, behavioural and memory functions. An example of how mood stabilisers are effective would be in the treatment of a person with bipolar disorder, where the drug lithium carbonate is commonly used. Lithium carbonate works by helping to stabilise the neurons in a person's body that are irregular due to their bipolar disorder. In particular, lithium carbonate works well during the manic stage of bipolar, but not so effective if someone is experiencing a depressive episode. The person may need alternative medications to help them control their depressed phases. When taking lithium carbonate, a person must also undergo regular blood tests to check for toxicity levels, as lithium has a very tight therapeutic range that, when exceeded, can possibly lead to irreversible brain damage. Some side effects to be aware of in the early stages of lithium toxicity may include nausea, vomiting, diarrhea, coarse hand tremors, and twitching. If in a later stage of lithium toxicity, then some side effects can include fever, decreased urinary output, low blood pressure, irregular pulse, and seizures. Other known general side effects of lithium may include weight gain, difficulty concentrating, fine hand tremor, increased thirst, and dizziness.
With any medication, it is important to understand how to safely administer your medication, when to see a GP, and what to look for to manage any signs and symptoms that may arise. This will ensure that you're getting the best possible outcomes from your medication. Mood stabilisers affect your brain to gain a steady emotional state. If you use any over-the-counter medication or natural bush medicines, it is best to discuss these with your GP. Some medications may stop mood stabilisers from working, or you may not get the full effect from your medication. Discussing with your GP or health advisor when in doubt is always best. Some side effects from mood stabilisers may include dizziness, raised blood pressure, headaches, nausea, vomiting, increase in body weight, memory loss, which may include problems creating new memories. Mood stabilisers may affect kidney and thyroid function also. Highs and lows may not be felt by patients taking mood stabiliser medications and can sometimes be the reason why patients stop taking them altogether. This may cause adverse effects to the patients such as cramps, convulsions and vomiting due to the sudden stop of medication. This is not advised. When first starting a mood stabiliser medication, you should refrain from alcohol, driving or using heavy machinery. It can take up to 1 to 2 weeks for the medication to take effect. You should not stop or change your medication in this period. If you're concerned, you should talk to a health professional or pharmacist. Another tip to remember is when taking any mood stabiliser medications is to remember to stay well hydrated. One of the side effects is urine frequency, and this can cause dehydration. Patients need to be aware that most mood stabilisers come in 2 forms. The first helps with mania and the second helps with the depressive symptoms. It is one or the other. That is why some patients need to take a combination of medications for their illness. That's why it's always important to read the instructions and take as directed by your doctor. Never increase or stop medications without consulting your doctor. If you miss a dose, you can continue as normal with your medications. Missing 1 dose will not affect their process. Stopping altogether, however, will. Remember to keep all appointments with your doctor for review of your medication. The doctor may want to check the levels of your medication are within the same safe limit. This is done via a blood test. Your doctor may also discuss how you are feeling and whether or not the medication you are taking is appropriate for you.
Now that you've heard the educational videos, I would like to summarise what was discussed. Please remember that there are different types of mood disorders that usually will consist of a manic and a depressed episode. Certain medications will be used to treat different disorders. Though it is important to remember that just because one medication works for someone with a mood disorder such as bipolar, it doesn't mean that the same medication will work for you. So it is important to keep in close contact with your doctor to ensure you are on the right medication. Toxicity levels and the previously mentioned side effects are something to always keep in mind so that you are aware of what's happening to your body, and you must let your doctor know as soon as possible if you're experiencing any type of these notable effects. In closing, I would like to reiterate the importance for people to remember whilst taking these types of medications that they can have dangerous or unpleasant side effects if mixed with any other medications. Therefore, you will need to be honest to your doctor to advise them of any other medications that is taken, like over-the-counter medications such as vitamins, minerals and herbal supplements. Also to remember that some medication can work within hours, or some medications can take longer, even weeks to work. Please remember to ask your doctor when they are prescribing medications to you to make sure that you understand everything about the medication and any type of side effects that it may have. So if you experience anything out of the ordinary that you notice is different to your body, please seek medical advice from your local GP or your medical centre to discuss. We hope that you have found our videos educational, and once again seek medical advice if needed. Thank you for your time today from Tracy Kearns, Nicole Jetta, Shannon Henderson and Kerry Coulthard.